Good afternoon, and thank you for coming today. I'm Judy Meehan. I'm the CEO of the National Healthy Mothers, Healthy Babies Coalition, and I want to welcome all of you to an exciting announcement about our Text4Baby program. Today, we are thrilled and very, very proud to announce major expansion of the Text4Baby program. Text4Baby, as many of you know, is a mobile health information service offering women information to take care of themselves and their babies and to give their babies a healthy, happy start in life. This next step forward is a significant expansion of the platform and our community reach, made possible by Johnson & Johnson and a multi-million-dollar, multi-year commitment to the program. I want to start by thanking Johnson & Johnson, our founding sponsor. Your company's commitment to families is beyond impressive, as is your commitment to Text4Baby and the way you have embraced this program. And again, we thank you for your generous, generous support. I'd like to take a moment to relay the significance of this commitment in terms of what it means for the Text4Baby program. First, many, many more women will be able to access critically important information on maternal and child health. Second, we will be able to engage thousands of additional partners in communities at risk. And it is most exciting that we are especially well positioned to achieve our long-term goal. We currently have over 100,000 enrollees in the Text4Baby program, which is incredible, but it's not enough. Our goal is to reach 1 million mothers by the end of 2012. 1 million mothers receiving solid science in a way that is easy and familiar to them to use, a way they can understand. 1 million moms getting the information they need to take care of their health and their babies. It's a bold vision, but Text4Baby has a track record of being bold. And it's because we have the commitment of so many important stakeholders. Our partners in public health have mobilized around this program because of the need. And it's a serious need. Sadly, many women in this country do not have access to health information that they need. Text4Baby is finding new ways to communicate with low-income women and new mothers who have limited access to critical obstetric and pediatric information. This idea of Text4Baby moved from a noble concept to a success story at lightning speed. This landmark initiative and unprecedented public-private partnership was the vision of a few dedicated people. The support of Johnson & Johnson at the outset made a huge difference. Combined with an innovative platform from Vaxiva and help from the federal partners, it took off. Officially launched in February of this year, Text4Baby is tackling an important problem and focusing on a segment of the population that is most at risk for infant mortality. The effort is guided by a few simple principles. To begin with, Text4Baby has harnessed the power of the wireless mobile infrastructure to provide an invaluable service for public good. By simply texting the word baby, or bebé in Spanish, to 511-411, moms receive 3 free SMS text messages each week, timed to their due date or their baby's date of birth. The program expansion will include features introducing increased activity, as well as more opportunities for subscribers to offer feedback to improve the service. The concept of free is one of the cornerstones of this program. Even a small cost would have been a barrier to many to take advantage of the program. I'd like to take this opportunity to thank CTIA, the Wireless Foundation, as well as the mobile carriers. The texts that they have helped us send provide reminders and vital information about immunization, nutrition, oral health, and child development. Fundamentally, without the support of the mobile community, the success of Text4Baby would not be possible. And that's one important piece. Another important element is our army of partners on the ground. We have over 400 partners, including public health agencies, state and local health departments, employers, and health plans, working at the grassroots level to reach our most vulnerable populations. As some of you heard Brian mention at lunch, what they are doing is amazing. With grassroots outreach, basic marketing tools, the public health community has adopted Text4Baby on billboards, in malls, in birth certificate mailings, and letters about Medicaid eligibility. Text4Baby is there because of our partners. We commend the efforts of all of our partners who have brought Text4Baby to this point. We have no doubt that this commitment will continue to grow because everyone involved understands the situation and the crisis that exists in maternal and child health. To give you a few important statistics, each year in the United States, more than 500,000 babies are born prematurely. An estimated 28,000 babies die before their first birthday. And glaring disparities exist in certain populations. Babies born to African American mothers are most at risk, with a rate of 13.5 deaths per 1,000 births. Today, with this significant multi-year commitment from Johnson & Johnson, we will be able to ensure that thousands more women are able to take advantage of this service. And we have more good news that Todd will be telling you about. The U.S. government is also expanding its support of Text4Baby. So again, I want to thank everyone here, especially Johnson & Johnson, our founding sponsor, and express my gratitude for working with us to take steps in addressing critical problems and also in making a lasting difference for mothers and babies who need it most. And now I'd like to introduce Todd Park, who is the Chief Technology Officer for the U.S. Department of Health and Human Services, who will give us an update on the federal government.
Thank you so much. It's very exciting to be here today. It's such an exciting moment for Text4Baby. We in the U.S. government are extremely excited about the potential for Text4Baby to help moms take good care of themselves and their babies. We're delighted to join the Text4Baby Coalition in the campaign to enroll 1 million moms by 2012. Totally doable. Totally doable. To help do so, we'll be strengthening outreach efforts to folks who may benefit from the Text4Baby service through Medicaid, WIC programs, community health centers, and more. And a primary objective of the Text4Health Task Force that Secretary Sebelius has formed that I announced yesterday is to figure out how to take U.S. government promotion of Text4Baby to the next level, again, to get to that totally achievable goal, 1 million moms by 2012. We're also engaging in two efforts, one led by HHS's Health Resources and Services Administration, HRSA, and the other led by the Department of Defense, which was looking at military moms, to evaluate Text4Baby's impact. The Text4Health Task Force we talked about yesterday will also be focused on how to clone Text4Baby simultaneously in areas like smoking cessation and childhood health. Through Text4Baby, we hope to better understand how cell phones can be used to improve public health generally. We're super enthusiastic about the power of mHealth to improve health. And again, we're just super excited to be part of the Text4Baby Coalition with such terrific partners. And go, Text4Baby, go. Rock on.
I'm Paul Meyer from Voxiva, and most of all, I want to just say thank you. Text4Baby was a dream a little over a year ago, and thanks to so much hard work from so many incredible partners, it is already a growing baby, and will soon be even bigger. Yeah, I want to thank Judy, you and your leadership from Healthy Mothers, Healthy Babies that have been so instrumental in making this an incredible success. The federal government has been an incredible partner. Todd, you and your colleagues, Hillary Chen from the White House, Paul Stang, so many others across the federal government that have helped make this happen. I want to really offer my sincere thanks to Johnson & Johnson and personally, Brian, to you. I remember a first conversation, it was probably about 15 months ago, when we came to you with a concept that was really just a concept at that time. And you believed in it and supported this from the outset, and we're so incredibly gratified and appreciative of your and your colleagues stepping up to make Text4Baby even better. And Kim Bassett from CTIA, you and your colleagues have been gone to extraordinary lengths to make this program a success, and without you, this wouldn't have been possible. I also just want to speak a little personally. with some colleagues, started Voxiva about 10 years ago. We were sort of some of the crazy people that thought that phones and health might have something to do with each other. And for about the first 7 or 8 years, we were the sort of the crazy people in the wilderness talking about this idea. It's really gratifying to see this conference, to see that this field of mobile health is really coming into its own and becoming a real field. I think it will give a little perspective on sort of how Text4Baby came about. It really was a series of conversations. We realized that in some ways the developing world was actually embracing mobile technology and mobile health technology more quickly, really out of necessity. A few of us talked about, well, what could we do to really help jumpstart this field of mobile health in the United States? What could we do that would be really visible and high profile, that would really open people's eyes to the potential of mobile health and really help catalyze this field and this industry? And those conversations really were what led to Text4Baby, and we started looking at some of the data and looked at the shocking infant mortality statistics that Judy knows all too well. But we looked at, all right, so we've got these infant mortality statistics and where are the worst birth outcomes in lower income minority populations. What we then looked at is internet penetration versus cell phone penetration. And when you actually overlaid those two data sets, you realize that the women who had the worst birth outcomes, who needed this kind of service most, were not online, but they all had cell phones and they were all texting. And so in some ways that was really effectively the opportunity that led to the creation of Text4Baby. I can't say, even though I'm sort of the optimistic entrepreneur, I had no idea that Text4Baby would grow as much as it has. And again, that really is just a testament to all the hard work of the incredible partners that we have in this. So again, as my colleagues here know, I can go on all day because this is my favorite subject, other than my twins. But this is my third baby, I joke. Anyway, but I will pass the microphone on to Betty Jordan, who will talk about some of the local efforts.
Thank you. My name is Betty Jordan, and I am an assistant professor at Johns Hopkins School of Nursing. I also serve on the board of Healthy Mothers, Healthy Babies Coalition. And I am so thrilled to be here today in support of the Text4Baby program, because I really do believe it's making strides in educating women whose babies are sadly most at risk for being part of a crisis that exists here in this country, infant mortality. In my day-to-day work as a community nurse, I work with women who don't necessarily have the information that they need. And they have limited access to healthcare information, they have limited access to healthcare. This is a program that reaches those women. This summer, I had an opportunity to train community mentors from high-risk zip code areas. And we trained these community mentors, and we sent them out to canvass their own neighborhood and to encourage women to sign up for Text4Baby. Just a few weeks ago, I had an opportunity to look at the data. And in fact, the data showed that these community mentors were able to get women to sign up for Text4Baby, and that we were able to see a spike and reach successfully the target audience. So I believe in this program. I think that it is reaching the women that we want it to reach. I think we're able to provide great information to these women and make a difference. I am very excited about the future of Text4Baby and our goal of reaching 1 million mothers of 2012. And Todd, I think you put such enthusiasm behind that statement. Through our help of our amazing network of partners at the grassroots level, I am confident that we can reach this goal. Thank you.